For my presentation, I did a systematic review of the implication of gut microbiome health on anxiety disorders and depression, and investigation of potential treatment approaches. So to start, I'm going to talk about the gut-brain connection and a little bit about what that is, and then I'm going to go into different treatment options and how to alleviate symptoms of both anxiety disorders and depression, and then how we should move forward with the research that I'm going to talk about. So the reason that I did this research was because there's around 970 million people in the world that experience mental health disorders, and 5% of these people experience depression and 4% experience anxiety. Especially in more recent years, there's been an openness surrounding mental health, which has caused an increase in research and an increase of diagnoses for both depression and anxiety disorders. Between the years of 2014 and 2020, there was a 34.8% increase in prescriptions of antidepressants, which is the most common treatment for both anxiety disorders and depression. And this was because there was an increase in cases of depression and anxiety disorder, but it's also due to an increase in the need for treatments, especially patient-specific treatments, which antidepressants are not providing. As well, there's been a lot more research into the gut-brain connection, which has opened new alternative treatments for both anxiety disorders and depression. So first, a little into the gut-brain connection. So there's two main systems in the human body that correlate with the gut-brain connection, and that's the digestive system and the central nervous system. And then within these two systems, you have the enteric nervous system, the vagus nerve, and then the gut microbiome. So your enteric nervous system is composed of around 500 million neurons, and this means that it is able to act almost completely independent from the brain. It is the second highest concentration of neurons, second to the brain in the whole human body. So the enteric nervous system is actually able to process its own hormone signaling, inflammatory responses, and it's completely responsible for bowel movement, independent from the brain as well. And then you have the vagus nerve, and the vagus nerve runs from the brain through the lungs, the heart, the liver, the stomach, and the intestines. And the vagus nerve is how messages get sent from the brain to the gut and how a lot of motor processing signals are sent. And then the part that I'm really going to be focusing on is the gut microbiome. And this includes the entire environment of the gut, but more specifically the microbiota that compose the gut. So that's the bacteria, the fungi, the protists, the viruses, and all the microorganisms that are living within the gut. So more on the gut microbiome, it's kind of a cycle. So there's things that are going into the gut microbiome and causing it to act one way, and then there's things that the gut microbiome does that cause the body to act a certain way. So things that affect the gut microbiome are first your genetics, so the genes inside of you, what makes a person, and then the epigenetics, how your genes are affected by the environment around you. So this includes your diet, what you're eating is affecting your gut microbiome, mode of delivery, for example, babies that are delivered via C-section, they actually have a decreased number of certain bacteria within the gut, and they also have a higher risk for anxiety in the future as compared to those delivered vaginally. And then the environment is affecting the gut microbiome. Drugs such as antibiotics, if someone's taking antibiotics, that can decrease the diversity of their gut microbiome, meaning less species and less number of microbiota in the gut, and also exercise. And then what our gut microbiome is actually affecting is our food intake. For example, there's different microbiota that line the entire gastrointestinal tract, and they actually crave different foods based on what they're getting fed, and so that's actually a reason for a lot of our cravings. And then as well, scientists are linking the health of the gut microbiome to cognitive behavior and a lot of neurodegenerative diseases such as Parkinson's disease, and then also a lot to do with your mood as well, such as your happiness, stress, and your need and want for social interaction. So the gut microbiome is really, really important because it's the largest and most diverse composition of microbiota within the entire human body, and that goes through the entire gastrointestinal tract. And then, as I stated before, your gut microbiome begins to be formed right after you're delivered, and then it's highly variable until around the age of 3. So that means the microbiota are changing and the composition is highly variable, but once you reach about the age of 3, that's when the gut microbiome is comparable to an adult's. So that's when, between the ages of 3 and adulthood, the gut is actually much more harder to change. And then as well, you need to make sure there's a balance of good and bad bacteria. Obviously, you want more helpful or good bacteria than the harmful, but it is normal to have a little harmful bacteria as well. But we want to make sure that there's not too much harmful bacteria, or that can cause something called dysbiosis, which could need medical intervention. So now I'm going to focus on the stress aspect and how the gut microbiome is affecting anxiety disorders and depression. So scientists have started to correlate anxiety disorders and depression to a lot of different gastrointestinal issues. For example, a lot of common psychiatric disorders share commonality with gastrointestinal issues such as irritable bowel syndrome or IBS. And then obviously there's different types of anxiety disorders and depression, but I kind of use more of a blanket term in order to encompass all the research that's going on right now. And I use both anxiety disorders and depression because there is generally a link between the two, as many people who are experiencing depression also experience symptoms of anxiety. And the two most common treatments right now for anxiety disorders and depression, the most common is antidepressants. However, there's a serious stigma surrounding antidepressants, as many are perceived as weak for taking, which causes a lot of people not to actually take the medication. And also the efficacy is highly variable, which I'll talk about later. And then the second most common treatment for both anxiety disorders and depression is psychological therapy. But again, economic situation, geographic situation can also impact the efficacy of therapy as well. And then something else really important to note on before I go a little deeper into treatments is the way that a lot of these treatments and research is being conducted, and that's on mice in rodent studies. So one study that really contributed to the knowledge of the gut-brain connection was when a certain set of mice were kept from all high microbiota interactions, meaning that the diversity of their gut microbiomes was significantly lower than a usual mice. And these mice were actually demonstrating lower levels of serotonin, which is a neurotransmitter that actually increases mood, and they also were, they had a change in nutrient intake. So this shows that the gut microbiome, the composition of that actually really is affecting symptoms of anxiety disorders and depression, as when there's lower diversity in the gut, there is generally higher expression of both anxiety disorders and depression. So now some treatment options. So you have the traditional treatments, as I said, antidepressants is the most common, and the interesting thing about antidepressants is that no one actually knows the mechanism behind how antidepressants work. The only thing we know is why they work, and that's because they're increasing the level of neurotransmitters in the brain, such as serotonin and noradrenaline, which generally increases mood. However, there's an abundance of side effects that come with taking antidepressants, and this can be nausea, vomiting, and for a lot of people after onset of medication, this can mean increase in suicidal thoughts, which can obviously pose issues. And as well, the efficacy rate is relatively unstable for antidepressants. There was one study done where some of the people were given a placebo pill, and this means there was actually no medication in their pill, and then others were given antidepressants. And people that took the placebo demonstrated a decrease in symptoms of about 20 to 40%, when people that were taking antidepressants only experienced about a 40 to 60% decrease in symptoms, which obviously shows the variability in the actual efficacy rate of the medication. And then as well, therapeutics can be highly variable because, again, it is person to person. So the therapists, they all have different methods of treating, and then each person is going to react different to the treatment as well. And the same, as I said before, economic situation and geographic situation can also impact the use of these treatments. So this really shows the strong need for alternative treatments, not only because of the side effects for this, but also with the new research on the gut, because none of these are actually treating the gut itself. Antidepressants have been actually shown to decrease diversity of the gut microbiome, which poses even more issues towards the expression of anxiety disorder and depression. So the first alternative treatment I'm going to talk about is diet change. So as I said before, a more diverse microbiome, meaning more species of microbiota and more number of microbiota, generally means less symptoms of anxiety disorders and depression. So in the last few decades, cases of anxiety disorders and depression have actually increased, and a lot of scientists have linked this to the increase in the westernized diets, meaning higher levels of processed foods, fast foods, and sugar being consumed. And so that has caused a lot of increase in cases. But as well, when we're talking about diet change, it's really important that we don't restrict our diets. There was one study done where people that were not gluten intolerant or had celiac disease, when they cut out gluten, it actually showed to increase their symptoms of anxiety because it was decreasing the health of their gut microbiome. So it's really important that we look on how to change our diet rather than restrict our diet. So the first diet that's proven really helpful in increasing the diversity of the gut microbiome is the Mediterranean diet. And this includes foods that are high in proteins and fats. And you can see on this food pyramid all the different foods that go along with this diet. And those are really important to increase the diversity of our gut microbiome. And then as well, foods that are high in fiber are also really important. And you can see that in this picture here. Because when fiber is actually consumed, it creates microbial metabolites, and this is what's actually feeding the individual microbiota within our gastrointestinal tract. As well, probiotics are really important, and there's a common misconception that we can take probiotic supplements, but that's actually not correct completely, because probiotic supplements are relatively unregulated, which means that as one company could be saying you're getting a certain dose, and another company could be saying the same dose. They're actually completely different dosages, and the bacteria inside might not be the same as well. But the reasoning for consuming probiotics in these probiotic-rich foods is because they're actually decreasing the number of harmful bacteria within the gut while simultaneously increasing the helpful bacteria as well. And then fermented foods are also really important. And the number one reason for this is because they include high levels of probiotics. but they're also really important for decreasing inflammation proteins within the gut, which has been shown to also decrease levels of anxiety disorder and depression symptoms. So, and now on a more medical route, fecal matter transplants. So this way is another way that has been shown scientifically to actually decrease symptoms of anxiety disorders and depression. And the way that fecal matter transplants, they're also called FMTs, the way they work is it takes stool from a healthy donor, and this means that the donor has done significant blood testing, STD tests, and other tests to ensure no infection or disease can be transmitted through the stool. Then that stool is processed, and it's either given in the form of a pill or a liquid. So the only way that's approved for FMTs right now is to treat C. diff, which is an infection many patients will get in the hospital. And it actually, by taking the FMTs, it increases the microbiota diversity, which then can fight the infection better. And there's an 85 to 90% efficacy rate for this treatment, which obviously is more effective than antidepressants. Although it's like a statistic for a different infection, it's still important, I think, to bring up. And then the way that we know that FMTs are actually working to treat anxiety disorders and depression is from a lot of, I said, like rodent studies. So one kept some mice in chronic subordinate colony housing, and this means these mice were under a lot of stress, and they were experiencing symptoms of anxiety disorders and depression. And there were also mice that were kept in single housing. And when the fecal matter from the single mice was given to the stressed mice, they actually showed decreased symptoms of anxiety disorders and depression, which shows that the microbiota composition is actually changing the expression of both anxiety disorders and depression. And then in another study, human fecal matter from a stressed donor was given to a non-stressed mice. And when this happened, it was shown that the anxiety phenotype is actually carried through fecal matter. So it's really helpful to have someone that's not stressed donate their fecal matter to someone who may be experiencing anxiety disorders or depression. So now the way that FMTs work is either through enemas or colonoscopy, which goes through the rectum, endoscopies, which can go through the mouth, or in the form of pills as well. And the really interesting thing about FMTs is they can last up to 6 months, which would show kind of a less need for more recurrent treatments. And as well, although the price is relatively high right now, researchers expect that with more common usage of FMTs, they'll be relatively similar to that of antidepressants. And the biggest drawback is obviously the procedure, as many people are uncomfortable with receiving the stool from another donor, even if they have been tested. So then the second alternative treatment is microbial ecosystem therapeutics 2, also known as MET2s. So MET2s are taken orally, and there's around 40 strains of bacteria that go into the gut microbiome during this process. So the way in which it works is, again, similar to an FMT, stool is taken from a healthy patient. Then the major difference between MET2s and FMTs are that MET2s actually extract only the healthy gut bacteria, then they purify that bacteria and they grow it out, freeze dry it, and then encapsulate it. So this ensures that there's no harmful bacteria in the stool going to the patient. And it also is more accurately reproducible due to taking out specific bacteria in order to give to the recipient. As well, it's more accurately reproducible because for the recipients, their microbiota levels are tested before and after this therapeutic method, which would ensure that the treatment is actually working, which is very helpful to know. And then the one downside is there is more further research needed because MET2s are relatively new in the research field, and there's really no long-term outcomes that we know of so far. So before actually putting this into practice, there would need to be further research on that. But as I said, MET2s are the most individualized of these treatments, and especially for people with more severe cases of both anxiety disorders and depression, this could be really beneficial. And then the major way that they're getting tested right now is for major depressive disorder, and they have been shown to have high efficacy rates when it comes to treating major depressive disorders. So in conclusion, currently there's a low efficacy rate for antidepressants, and therapy is just not available for all people. And so there really is this strong need for alternative treatments, especially with the knowledge of the gut-brain connection that we have, knowing that with a more diverse gut, there are decreased symptoms of anxiety disorders and depression. So for a plan of action, diet change provides the most concrete research. So we know that by changing our diet, we can increase the diversity of the gut microbiome, and especially with people with more mild cases of anxiety disorders and depression, this could be the answer to alleviating a lot of their symptoms. However, MET2s are providing the most hope, especially for people with more extreme cases of anxiety disorders and depression, because they are more specific, more effective, and they generally are more effective than the FMTs, like I mentioned, and they hopefully would have less of a stigma than the FMTs because this is more purified and healthy bacteria going in from the stool. However, there is more funding and research needed in order to actually put this into practice. However, the best plan of action would be to pair MET2s and diet change in order to ensure the most alleviated symptoms of anxiety disorders and depression. So further research needs We not only need to continue researching treatments, as I said, but we also need to continue research on the gut-brain connection, because once we find the exact root of anxiety disorders and depression, then we can work on treating that more specifically, which is really important in order to ensure better efficacy. And we also need to continue research on both the MET2s, diet change, and FMTs to see more long-term outcomes of all the different treatments. Thank you for listening. Perfect.
So Addison, well done.
Thank you.
I think this is such a super interesting topic, and I'm just curious how you got interested in it and decided to do your presentation on it.
Yeah, so I was actually watching a documentary on this. It was called The Gut. It was called Hack Your Health, and it was all about the gut. And I actually got really interested in it because I was watching it, and it was talking about, I had never known that anxiety disorders and depression, like a lot of these symptoms are from what we're eating and the health of our gut, and I had never known that before, and this documentary really showed that. And then it also talked about FMTs and how those could be a potential treatment. And so I wanted to see really the efficacy rates of those and how your gut is really affected your mental health as well.
Wonderful. So if it is due to a more westernized diet, can you speak to any research that you did looking at gut microbiome in areas that don't, or countries that don't have more of a westernized diet, and talk about the comparison between those?
Yeah, so there is a higher cases of anxiety disorders and depression in countries with more westernized diets, such as America, especially in comparison to countries and more like rural places, such as rural Africa. There's studies showing that there are more diverse microbiomes in places such as rural Africa, because they're not getting these processed foods, and there's also decreased symptoms of anxiety disorders and depression in terms of like percentages per people in these places as well.
Going on the same background, okay, cultured foods will give you more bacteria in your diet, that's great, but how's the sugary food not going to give so many bacteria? Like, what's the reason there's no microbiome growth after sugar?
Yeah, so there's a lot of different ingredients in the processed foods that actually don't contain any live like a lot of the foods that I mentioned do have like live bacteria, like the probiotics, and they also have specific like acid chains and things in them that are reacting positively with the gut, whereas a lot of the processed foods cut out a lot of the like the helpful nutrients and the helpful compositions, I guess, within the foods that are actually not benefiting the gut.
I have another question. Did you stumble upon any research that's being done to help these children, the babies that are being born via C-section, to replace the microbiome that they're missing?
I actually didn't come across any of that research. That's a good question, though, that I'd like to research in the future.
Mm-hmm. It's definitely not talked about enough.
No, it's not. Like, I had no idea that even babies that are delivered via C-section, they actually have decreased bacteria of certain levels. And I think that's really important that they have those bacteria, because, as I said, like when you're a child, that's when your microbiome is the most changeable. And so that, I think, would be really important to keep researching.
And to follow up, you said that by like the age of 3, a lot of the microbiomes are set for.
Yeah, they're not set for life, but by the age of 3, that's when you really can compare a microbiome from a child to an adult. So they look relatively similar. And although it's able to change the composition, it would just take more time, which is why for a lot of people, diet change is a slow process, and that's the reasoning behind that, is because it is really hard to change the composition of the microbiome after the age of 3. But it's possible. Like, you just have to take more time than it would for someone below the age of 3.
With this sort of thing, I always wrestle the difference between correlation and causation.
Mm-hmm.
And I wonder, does the scientific community feel like they're at a place where they can say definitively there is a causal connection between gut health and mental health? Or are they just kind of, there seems to be a link and and there just needs to be a ton more research?
So I do think there needs to be a ton more research. I agree with that. And I think we are at a place where we can say there is a connection between the gut and the brain. But I think, as you said, we need to consider it more as a link than a causation, because there are so many other like systems in the body that are also contributing to that. I just think a lot of scientists have said that this may be like the main actual cause, not the cause, but the main reasoning for a lot of these symptoms getting expressed, especially because we don't exactly see a certain way that the brain is causing these symptoms.
So if a patient does the FMT or the MET2 once, it's not permanent? Like it wouldn't
No.
permanently change the gut microbiome, and why is that?
No, I think that also has something to do with the diet as well, because if you're not, that's why I said we should really pair either the FMTs or the MET2s with diet change, because if you're getting these FMTs and it's changing the composition of your microbiome for say up to 6 months, but then you don't get it again and you're still eating the same way that you were eating, then you're just going to go back to the composition you were already at, which I think is either important to keep the diet changed with the FMTs or the MET2s, or just to continually get the FMTs and MET2s.
There's a heart surgeon who is on media, social media quite a bit, hawking his products, but also arguing a great deal about gut health and talking about foods that he considers to be poisonous, which includes most of the stuff that has sugar, and tomatoes, surprisingly, because he says it causes leaks in the gut. And he's done a great deal of research. He started off his own personal history as a heart surgeon who was overweight, and he realized that he was counseling people about lifestyle changes when he himself was not doing the same thing, and that led him to working on diet and then getting involved in gut research. So all what you're and he talks about much of what you discussed today, that the gut is sort of the it's not the brain, but it in many ways, like the brain, it has a huge role in the overall health of the body.
Exactly.
From inflammation to all sorts of things.
Yeah.
And I don't know if I think his name is Gunfrey. I mean, he has a whole line of products that he's trying to have people buy. I'm not sure that, I don't know anything about that part of it, but I've listened to him talk about this, and I have a primary care doctor who's also very interested in this area. So it is starting to take some traction, but I'm wondering, in the psychiatric community, how widespread is this association with what they're dealing with and their decision that maybe we need to look at the patient from another perspective, not just look at the brain chemistry.
Yeah.
Let's look at their gut issues as well.
I think with this being novel research, there's not a lot of like psychiatrists, I think is what you're asking, kind of either recommending diet change or especially not the FMTs or MET2s because of such current research, but I think a lot of nutritionists and a lot of even primary care physicians suggest diet change for both anxiety disorders and depression. So I think diet change is really the one that's getting pushed right now the most. But I do think in the future that FMTs and MET2s will be pushed, maybe not by psychiatrists, but by like primary care doctors or nutritionists and people of that sort.
How will we ever get to a point where we're eating a diet that would be healthier for the gut?
Yeah, I think that's really hard, especially in America when really, I guess, time is a restraint for a lot of people with fast food. And then also a lot of the processed foods we're eating, especially even a lot of these nutrient bars aren't actually as good for us as they're saying, especially they aren't actually doing anything for our gut, more negatively impacting than positively. And so I think it's really taking the time to actually sit down and figure out a diet plan that works for each specific person, and then even meal preps, because I feel like in today's day and age, there's a lot of time constraints, as I was saying, and I think meal prepping can be one way in which people are actually able to see this change in their diet, because just by eating bars or eating out every night, that's really not going to benefit your mental health.
Would you see yourself doing any further research on this topic going forward?
I would. I think in college I would love to keep researching the gut because I think it's really interesting, especially now that I know it is affecting mental health as well. I think I would love to go more into that because there's so many other ways you can go. Like the gut microbiome is affecting people. They've actually found fecal matter transplants are helping decrease symptoms of autism. They're helping with obesity. They're helping with a lot of different neurodegenerative disorders as well. So I think there's so many different ways I could have gone with this research, and I would love to keep going with it.
See, it seems like this is something that would almost need to be aligned with the food pyramid.
Yeah,
It's a whole different way of thinking about food.
it is.
And in order to educate like across economic levels and different regions, rural and urban, et cetera.
I agree. I think there needs to be definitely a more like uniform or a more concrete diet that we need to kind of put out into the world to show like this is what but again, the diet is different for everyone. Their compositions need different foods. But I do think if there was more information given out on how to exactly change your diet in a positive way, that would be definitely more helpful.
Who's Samantha Lynch?
That's her in the back right there. She's a nutritionist in Vero Beach, and so she actually does a lot of things like this, especially to help people who are experiencing symptoms not only of anxiety disorders and depression, but she does other medical issues as well, I guess. And she sees that a lot of change in diets actually are very beneficial for most people, especially those who may be experiencing some mental health disorders.
Can I ask how you got connected with
Of
this?
course.
In this relationship?
Of course. So her daughter's actually in my brother's grade, and so we met from me going to camp with her daughters, and then we talk a lot about the gut, and so I got really interested in it, and then I called her, and she was really willing to help. So,
Right.
yeah.
Great. Thank you very much.
Of
Great job.
course.